Hey guys, Kim here, and you are tuned into Kim E, the Diabetes MP. Now, we are in March, and my theme for the month is diabetes complications. I've already made a couple of videos over this, not only for my nursing videos, but also for my patient corner videos as well. That's a segment that I created as a means of patient education. So if you find yourself not having the time to educate your patients, use those videos. They're free, they're quick, and I try to make sure that I get right to the point with them. Now today, the complication that we're going to be diving into is peripheral artery disease, commonly known as PAD. So if you want to learn more about this, stay tuned. We're going to get into it. So what is peripheral artery disease? Now, this is a very common complication. It actually goes undiagnosed a lot. A lot of times when it is picked up, it has been there for years. The statistic actually says that 1 in 3 people who are older than 50 are likely to have peripheral artery disease. That's a lot of people, guys. So we do need to be screening, okay? We need to be screening. We also need to know what it is so we can screen and be able to diagnose, and we need to know the proper mode of treatment for it. Like I said, it's very common, and basically what's happening here is that the blood vessels are narrowing down, and there's many things that can put somebody at risk for this. Of course, diabetes, but also uncontrolled blood pressure, uncontrolled cholesterol, smoking, and to be honest, the natural aging process. You're going to see some form of a little bit of decreased circulation as what it really is, because as those vessels are narrowing, the blood cannot flow as it should through there, okay? So basically, in a nutshell, that's really what PAD is. Some of your common complaints that you would see from your patients, you'll notice that they'll probably complain of leg pain. They'll probably also, you'll notice that they don't have hair on their legs. Now, I don't know if y'all were told this in nursing school, but I remember being told this in undergrad when I was working on my BSN, that hair won't grow where blood doesn't go. And that's a key symptom there. That's a classic thing that you can think of. If you notice that on their extremities, especially in your men that won't be shaving, if you notice that they don't have hair on their legs, you can start anticipating that there may be some PAD going on there, some circulatory issues going on. You may even notice some skin discoloration as well as some flaky, dry skin. These are all some key things that can kind of perk you up to think, what's going on here? Now, your classic symptom is intermittent claudication. Now, we know that to be leg pain that probably shoots up into the calves, the thighs, up into the buttocks, and typically is worse with activity. But with the diabetic, catch this, it's actually the reverse. With the diabetic that has the intermittent claudication, it's actually activity relieves the pain. They actually have more pain when they're at rest. Period, guys. However they come into you, if they're talking about achy legs, anything like that, this is a clear sign that you need to be screening them. Different ways that you can screen them. You can do portable tests like a QuantaFlo. If you don't know what that is, I'll link a video that kind of demonstrates that. Also having them have an AB index, okay, ABI. You can do it in your office if you feel comfortable doing it, or you can send them out to have it done. So that is how you would diagnose it, and really honestly, even from there, you would get them over to a vascular doctor so they could do more definitive tests on them. But the screening and the detection, that is very important. Now, your diagnosis and treatment. This is important, okay? Now, the most important thing is screening. I just mentioned that not too long ago, but screening is important. The reason being is that PAD increases the risk for other cardiovascular events to happen. If there's PAD, then there's probably some other things that are brewing as well. So we need to get out ahead of these things. Also, PAD is one of the one of the things that puts people at disability. Okay, if people are not able to walk, they're having leg pain, their quality of life really decreases. So we want to make sure that we're getting it early on and we're doing this early detection so we can prevent it and stop it in its tracks, guys, because we want our patients to have great quality of life. And like I said, like I have been saying with many things on my channel, a good H&P is necessary, okay? It's very vital. Of course, talking with your patient, getting that good history, asking them about the leg pain, you know, following up, looking and actually observing, doing a good foot exam, checking their pulses, checking the temperature of their extremities, you know, asking them, do your feet, do your legs stay cold? These are all key things, guys. The QuantaFlo test, the ABI test, again, I'll link a video in the description box if you need some more reference for that as well. Also, eventually you probably will be sending them out to a vascular laboratory so they can have more extensive testing. But the things that we can do in our office, in the primary office, is making sure that you have good blood pressure control, that you are really making sure that the cholesterol, the lipid panel, is within normal limits, and you're making sure that you're taking care of the person's cholesterol. Also, lifestyle modifications. I have made a video over that. I have a couple of videos that fall in line with that. I'll link all of those in the description box as well. But making sure that they're quitting smoking, making sure that they're exercising, that they have a good diet, low sodium diet, low fat diet, a well-balanced diet. All of these things would help prevent and actually stop whatever is going on, any process that's currently going on. All right, guys, that is all I have for you. I hope that this was a very informative video, that you learned something new out of this video. For anyone who is new to my channel, go ahead and subscribe if you like what you were hearing and seeing, and make sure you ding that notification bell so you do not miss an upload. For those who have been riding along with me this whole time, thank you. I appreciate you. I love interacting with you all over on social media, on Instagram. I love interacting in email and in the comment section. I just really love it. So keep it coming, guys. And one quick reminder that I want to make sure that I leave you with, because we are all nursing colleagues. Let us never, ever, ever leave a nurse behind. Okay? Talk to you guys later. Bye.